Have you all heard about shockwave treatment for erectile dysfunction? Well, today I'm finally putting together the video many of you have been asking for on this topic. I'm Dr. Rena, a urologist and pelvic surgeon, and if you're new here, we cover everything related to urology, sexual health, bladder health, and much more. Be sure to subscribe so you don't miss my new videos every single day. So, what exactly are shockwaves for erectile dysfunction, and how do they work? The full name is low-intensity extracorporeal shockwave therapy, and in this video, we'll go over a few key points. First, how this treatment helps improve erections. Second, what the research says about shockwave therapy and who tends to benefit the most. And third, what American and European guidelines say about this treatment. Finally, we'll talk about how to make sure you're receiving the proper care. So, how does it actually work? Shockwave therapy sends gentle acoustic waves into the tissues of the penis, creating controlled mechanical stress. The body then begins a healing process, and it's during this recovery phase that improvements in erectile function can occur. The idea is that this process encourages the growth of new blood vessels and may even support some nerve repair in the penis, which means it could potentially reverse certain types of damage. What happens is that the cells affected by these waves release substances like vascular endothelial growth factor and fibroblast growth factor. These are essential for building new blood vessels. In simple terms, more blood vessels mean better blood flow, and better blood flow leads to stronger erections. There is also some evidence from animal studies suggesting that the healing process after shockwave therapy may release factors that help nerves grow, which could be helpful for men with nerve-related issues. However, we still need more research in this area. So, what does the current research tell us about shockwave therapy? We have something called meta-analyses, which are studies that review and combine results from many different research papers to determine whether shockwave therapy truly works. All right, let's break this down. There are two meta-analyses I want to discuss. The first one focused only on randomized controlled trials. So, what does that mean? It means some patients received shockwave therapy, while others either received no treatment or a placebo. They thought they were getting the treatment but actually weren't, and then the results were compared. This type of study is considered the gold standard in clinical research because it helps us clearly understand whether improvements come from the treatment itself or simply from the belief that you'll get better, which can sometimes influence erectile function. These particular studies included men with organic erectile dysfunction, most commonly caused by vascular issues. For most individuals, this is related to conditions like high blood pressure, diabetes, and other health problems that reduce blood flow to the penis. The studies did not include men whose erectile dysfunction was caused by radiation therapy or those with chronic pelvic pain linked to their symptoms. In this meta-analysis, 7 studies from 5 different countries were included. However, there wasn't a single standardized approach. The type of shockwave machines varied, the number of pulses differed, and even the treatment areas on the penis were not consistent. There are 3 main types of shockwave devices: electromagnetic, electrohydraulic, and piezoelectric. All of them generate focused waves that can reach deep into penile tissue, which may help stimulate the formation of new blood vessels and possibly support nerve repair. The most common treatment plan involved 6 weeks of therapy, totaling about 12 sessions. Typically, this meant 3 weeks of treatment with 6 sessions, followed by a 3-week break, and then another 3 weeks of treatment. Still, this schedule was not the same in every study. To measure results, researchers used validated questionnaires designed to assess erectile function. What they found was a statistically significant improvement in erectile function just 1 month after completing shockwave therapy. Now, 1 month isn't a very long time, so what do longer-term studies tell us? Another meta-analysis looked at a broader range of clinical trials. So, in this analysis, they included both randomized controlled trials as well as cohort studies, where groups of patients received shockwave therapy and were followed over time to track their progress. Another key difference from the earlier meta-analysis is that this one also included men with Peyronie's disease, which involves curvature of the penis. They also included patients dealing with pain-related conditions that can affect erectile function. Now, based on all of this information, what are the major urology organizations that guide our clinical care actually saying? The American Urological Association updated its guidelines in 2018, and their position is that shockwave therapy should still be considered investigational and not used as a routine treatment for erectile dysfunction, mainly because of the limitations in the available data, some of which we've already talked about. Interestingly, the European Association of Urology updated their guidelines more recently, and they state that this therapy may be offered to men with vasculogenic erectile dysfunction, but only after proper counseling. So, what does that counseling involve, and who is the best candidate for this treatment? Shockwave therapy tends to work best for men with mild erectile dysfunction. This usually includes men who don't yet need oral medications, those who are responding well to them, or even those who have recently noticed that their medications are becoming less effective. Based on current evidence, these individuals appear to be the strongest candidates for shockwave therapy. There is some suggestion that men with more severe erectile dysfunction might benefit when this treatment is combined with other therapies, but the research hasn't clearly defined that yet. It's important to understand that results can be modest, with about a 50 to 60% success rate at 1 year. On the positive side, the treatment appears to be quite safe, with very few reported side effects. So, the main considerations are usually the time commitment required for multiple sessions and the overall cost. Speaking of cost, how can you be sure you're receiving the right type of treatment? As I mentioned earlier, the most effective therapies use focused shockwaves. Not all shockwaves are the same. Focused shockwaves have the proper depth and energy pattern needed to stimulate new blood vessel growth, unlike some other types that are commonly offered but may not be as effective. The other type is called radial shockwaves, and these are much more surface level. They don't reach deep enough to create the kinds of changes we see with focused shockwave therapy. Interestingly, radial shockwave machines are far less expensive, which means many men's health clinics that advertise shockwave therapy may actually be using radial devices instead of true focused shockwaves. And unfortunately, that type of treatment is unlikely to be effective. So, the best thing you can do is ask exactly what machine is being used and whether it delivers focused shockwaves. Also, because this treatment is still considered investigational in the United States, you may be able to find clinical trials studying shockwave therapy. That can be one of the best options. First, it allows you to see if the treatment works for you. And second, you contribute to advancing research that could help many more men in the future. There is still a lot we need to learn about this therapy. For example, what is the ideal treatment protocol? How effective is it for men whose erectile dysfunction is caused by other issues, like prostate surgery or nerve damage? And what about long-term results? Does repeating treatments later provide additional benefit? Another important question is whether treatment can be tailored to the individual. For instance, someone with mild erectile dysfunction might do well with a less intensive approach, while someone with more severe symptoms may need a more aggressive or frequent treatment plan. These are all areas currently being studied, and we expect to have much clearer answers in the coming years. Hopefully, this will become a strong treatment option for many men dealing with erectile dysfunction. For now, if you're considering shockwave therapy, make sure of 2 things. First, that you are receiving focused shockwave treatment, and second, that you understand results can vary depending on how severe your condition is at the start. While some improvement is possible, we still don't have solid, long-term data yet. Thank you so much for watching, and as always, take good care of yourself, because you truly deserve it.